When we are doing the dynamic visual acuity, another fine point needs to be differentiated. Okay. So there is one that is dependent, one kind of eye movement that is dependent on the semicircular canal. So when I actually move the head to the right side, the eye moving to the left can come from the semicircular canal's input, detecting that the head has moved to the right and therefore the eye needs to move to the left in order to be still able to maintain a straight ahead gaze at the object of interest. But it can also so happen when the person with his own volition, with his own intent, okay, is generating that head movement, a copy of that head movement is also sent to the extraocular muscles, and therefore even without the need for the semicircular canal, the person may be able to do a compensatory head movement. So in which case it so happens that we may not be able to differentiate between a real semicircular canal issue which is there, or a semicircular canal is there underlying, but then it has been compensated or it has been covered up by the person's efference copy. A efference copy is one motor copy of the head movement also reaching to the eye and therefore doing a compensatory movement. But this can be differentiated, and even if the person is employing an efference copy to stabilize gaze, we can still make out whether the person has a semicircular canal deficit or not by employing something called a passive head impulse test, where instead of the person making the head movements, instead of the subject who is undergoing the assessment making the head movement can be done by the examiner standing behind the person and doing it. So that is going to be the passive dynamic visual acuity, where somebody else is moving the subject's head. And then we can also quantify to what extent the person has centrally compensated for his peripheral deficit by doing a active test where the person does it. So that way we can really make a objective assessment of the extent of recovery and also objectively assess to what extent the semicircular canals are affected. So the compensation, the central compensation by employing alternative strategies like efference copy usage can be picked up by doing in two different modes, the passive and the active.